Hi, welcome to Unraveling Health. I'm Dr. Winnie Wong, and I have Dr. Lee Krushka here. We're both board-certified nurse practitioner. So, what do you have question on H. pylori today?
What is H. pylori?
Well, H. pylori stands for Helicobacter pylori. It is a bacteria that entered through your mouth when you eat something. And this bacteria can live in your stomach for many years before you start having symptoms.
Right, so there's some statistics showing that a high percentage of untreated bacteria, the H. pylori, and it can cause a stomach cancer.
How do I get the bacteria?
So how you're gonna get it is usually from contaminated food or water, or even from the sharing the food. So also there's some studies showing that the bacteria can be transmitted through the saliva in human being.
So even though if one person, one family member has tested positive for H. pylori, the rest of the family will have to get tested because you're sharing the same utensils.
Yeah, we know that there's a lot of practitioners that don't suggest that if they don't have no symptoms, they shouldn't be tested, but from our clinical experience, and there's actually they're positive, even though they don't show symptoms at the moment, or maybe they don't even know what the symptoms are.
How do I know that I have it?
So the symptoms can be vary from person to person, but most of the common symptoms such as acid reflux or nausea, even constipation, because somehow associated with the GI tract, and sometimes they have other symptoms.
Such as they have a lot of burping. Maybe, all of a sudden you feel a lot of gas coming up. Maybe it's the acid produced by the bacteria may cause you to feel a lot of pressure that you need to burp.
Yeah, that's why as a practitioner, we have to ask a lot of questions, be very thorough with the patients. And even my patient might think that, oh, I have a chest pain, but it actually is from the acid reflux. The typical symptom will be when they're laying down at the nighttime, and that's the symptom happens.
And how do I get tested?
Well, you're gonna need to see your healthcare provider. There are two tests. One test is the urea breath test, which you can readily, easily do it at your primary doctor's office. And the other, more diagnostic that they can do is?
They can be getting from the blood and also maybe from the stool. So from our clinical experience and also from standard of care, the most accurate is the breath test that you blow to the bags and they can easily get the sample. So just be mindful, not all the patients, they'll be able to follow the instruction to do that, and really depends on the histories and their symptoms as well.
And last but not least, sometimes, when specialists do an endoscopy, which they put a scope into your stomach, that also they will collect some specimen to check for the H. pylori too.
And be mindful about depends on the site of the biopsy. So there's a chances, small chances that I'll actually not be able to get the tissue that actually has a bacteria that's infected.
Is that curable?
Well, it is a curable, and so it's just like a cold, any typical of infection, right? So it is a curable. What we recommend is that if you finish the treatment and after about a month or two, and you should get retested. We know that there's some other practitioners don't want them to get treated, repeated the testing because it's not medical necessary. But we know that if we don't repeat it, how will we know that it's cured?
I agree. So those are the different steps we do to diagnose the patient and decide on treatment therapy.
How long is the treatment?
So the typical treatment is 2 weeks. So it's a very specific treatment, and some practitioners prefer a few antibiotics. They might have use different preferences. Also, we have to take consideration of the patient's allergy history as well.
Yes, correct. So when you have these symptoms and you suspect you might have this bacteria, please call your healthcare provider. If you don't have one, you can call us. We are Unraveling Health. Our phone number is 954-900-8981.
And we'll see you soon.
Bye-bye.